borderline personality disorder. Borderline personality disorder is a mental health disorder wherein your brain makes it hard for you to get to know yourself. Who is yourself? Yourself keeps changing because your self image keeps shifting every day. One minute you feel like you are a good, kind person who can pass off as an angel. The next, you feel like you are some kind of murderous criminal who belongs in jail. You don't really know who you are and you don't really know who you want to be. People with borderline personality disorder usually changes friends, schools, jobs, and careers frequently because their sense of self is abstract. These are the people who keep changing their course in college or their romantic relationships because they simply don't know what they really want. They can want one thing now but want something else tomorrow. Because of this reason, people with borderline personality disorder have a pattern of unstable relationships. However, people with borderline personality disorder or BPD have an intense fear of abandonment, be it real or imaginary, so they will do all they can to keep their partners way beyond the expiration date of a relationship. Try leaving a relationship with someone who has BPD, and you will be at the receiving end of a very abusive and explosive monologue filled with anger and resentment. The only way to leave a romantic relationship with someone who has BPD is to wait for them to leave you. You cannot leave them, but they can leave you. They can leave you when they have found a replacement for you. People with BPD despise being alone, and so they always need someone to take over your place when they decide they are done with you. People with BPD have difficulty managing their emotions and behavior, so you best stay away if you don't have the patience and understanding it takes to be with someone with BPD. It takes a special kind of saint to be able to be with them. People with BPD put their romantic partners on a pedestal. When they decide they want you, you become godlike in their eyes. You can do no wrong. You are perfect. You are a superhero. Well, until you're not. You will be perfect in their eyes for as long as they want to, but do one thing off of their expectations list from you, and you become enemy number one. You instantly, immediately become the worst person in the world. There is no in between for people with borderline personality disorder. Although a relationship with someone with BPD may be very toxic, the truth is all they want is to be accepted and loved. Sadly, their sudden bursts of inappropriate anger usually become a cue for others to leave. People with BPD are very impulsive and have frequent mood swings, so it is extremely hard for them to keep a harmonious relationship no matter how much they want one. People with BPD, because of their impulsive nature, usually gets involved with risky behaviors such as gambling, reckless driving, binge eating, drug abuse, spending sprees, physical violence, and unsafe sex. They may also sabotage their own success by suddenly quitting a job or ending a good, positive relationship. Without proper knowledge about their disorder, support, and coaching, they are unable to help themselves because it feels like there is this monster inside of them that has a mind of its own, wreaking havoc in their physical world without asking for their permission. The monster takes over their rationality and common sense and does things so inappropriate they feel drastic guilt and remorse after the monster is done with its rampage. People with BPD do not have mild feelings. All their feelings are very, very extreme. People with BPD are sometimes thought to have bipolar disorder because they have wide mood swings lasting from a few hours to a few days. They can shift from intense happiness to severe feelings of emptiness in a blink of an eye. People with BPD are also prone to making suicidal threats and engaging in self injury. This is often a response to fear or separation or rejection. So please, if you were in a relationship with someone with BPD, tread lightly. Remember, You love this person, so be responsible enough to make sure he or she is safe before anything else. So, you or someone you know has borderline personality disorder. What now? If you are aware that you have any of the signs or symptoms we just talked about, talk to your doctor or a mental health provider. You will most likely need to talk it out and walk through your disorder. In some cases, appropriate medicines such as antidepressants and mood stabilizers may be prescribed to balance the chemicals in the person's brain. So, what causes borderline personality disorder anyway? As with other mental health disorders, the causes of borderline personality disorder aren't fully understood. There can be environmental factors such as a history of child abuse, sexual abuse, physical abuse, and even verbal abuse. Chronic neglect can also be considered as a form of abuse. Children who have been exposed to hostile and unstable family relationships are at risk. The loss of a loved one at an early age also adds to the formation of abandonment issues in the child growing up. But not all people who were abused or neglected as a child grows up to have borderline personality disorder, so there may also be genetic factors and brain abnormalities involved. It would be helpful to learn more about your family tree and check and see if mental health issues run in the family. Knowing that you may be predisposed to certain mental health issues will help you greatly in tackling your own demons. Some research has shown that changes in certain areas of the brain involved in emotion regulation, impulsivity, and aggression could be the underlying cause of BPD. In addition, certain brain chemicals that help regulate mood, such as serotonin, may not function properly. Borderline personality disorder can damage many areas of your life. It can negatively affect intimate relationships, jobs, school, social activities, and self image, resulting in the following: repeated job and career change or loss, incomplete education, multiple legal issues that may include time behind bars, unstable relationships, inability to keep relationships, and divorce. Partaking in self-injury or self-harm, such as cutting, burning, repeatedly slamming your head in walls or punching walls until your knuckles bleed, resulting in frequent hospitalizations. Involvement in abusive relationships, attempted suicide or completed suicide. Unplanned pregnancies, sexually transmitted disease, motor vehicle accidents, and physical fights due to impulsive and risky behavior. People with borderline personality disorder may also have comorbid disorders such as depression, alcohol, drugs or other substance abuse, anxiety disorders, eating disorders, bipolar disorder, post-traumatic stress disorder or PTSD, attention deficit hyperactivity disorder or ADHD, and other personality disorders. If you have borderline personality disorder, don't get discouraged. Learning that you have a problem is half the battle. Once you are aware that you have BPD, you can actively change the way you think and the way you behave so you can learn to lead a more beautiful, satisfying life. Thanks for watching PsychPal. Please like and subscribe to our channel for more psych info.